Robert, at the panel last year, we had Jeff Drazen, the editor of the New England Journal of Medicine, really begging for people to do clinical trials to examine the impact of genetic testing, consumer genetic testing, on attitudes as they learn some of this complicated information in some cases for the layperson. This is something that this has been your pet project for the last decade or more, I guess, with the REVEAL study for Alzheimer's disease and APOE. Please bring us up to speed on what you've learned in that process.
Well, the REVEAL study looks at the impact, not just attitudes, but the medical, psychological, and behavioral impact of learning whether you have APOE genotype or not, which puts you at increased risk for Alzheimer's disease. But right from the start, we imagined it as hopefully a transformational set of studies that would inform what's going on in personal genomics. And that is because we saw this as evidence-based work using clinical trials methodology that would transform what has previously been a set of LC discussions. Previously, ethicists, legal scholars have been sitting around sort of saying, I wonder what would happen if you give this information to people. I wonder what will happen with the insurance industry, for example. Well, the REVEAL study was the first study to actually demonstrate that people do purchase more long-term care insurance based on their APOE genotype, something that's been talked about for a long time, never been empirically demonstrated before. So we see this as heading forward, and I see the greatest challenge of the sequencing that we're hearing about as what is going to be the impact of unexpected information, of unexpected incidental information that people learn about their genomes. So here in the front row, you, sir, you're a carrier of CF. You're a carrier of factor V Leiden. You actually have Lynch syndrome and don't know it. And one of the ladies up there, you happen to be a BRCA1 carrier. You suddenly discover that. What do you do next? And we are woefully unprepared. I'm in a genetics, I've gone back to training and to become a geneticist. I'm doing what Phil did decades ago. And what I'm discovering is that genetics professionals, genetic counselors, medical geneticists, are woefully unprepared for this transformation. And I can say more about that in a minute.
Dietrich, Navigenics is, the service has been 12 years old. It offers people affordably to get access to at least 500,000 SNPs and tells you information about your genetic susceptibility to a couple of dozen at least major disorders. I've had the pleasure of doing the panel and it's been very interesting. Talk us through the last 12 months. Is your business model, what have you learned? What has surprised you? And are you, particularly with regard to the direct-to-consumer channels versus working with perhaps more of the medical channels, how is that balance evolving?
Sure. So I think it's important to preface the answer by saying we're on the verge of a massive healthcare crisis, and it's caused by more people on the planet, a shifting age demographic to older age individuals, and our successes with infectious disease. And it's going to happen in the short term, in the next decades. And it's analogous to what we were seeing with respect to global warming before Al Gore made it made it common knowledge. And so that chronic disease has both a genetic and environmental component. Every chronic disease has a genetic component. And so 4 years ago, actually, David Agus, who's a clinical oncologist, and I started Navigenics and decided that we were going to implement a new paradigm, a broad-based public health type of genetic risk factor analysis and a delivery vehicle to get that to individuals and their physicians so that they could get their whole genome sequenced, extract common variants, rare variants, epigenetics, and copy number variants, totality of heritability for chronic disease, and communicate that information in an intuitive way to individuals in a portfolio-based, rank-ordered way so that then they could avoid exposures that they might be particularly sensitive to, present for early screening, and get on therapy, the right dose earlier, which hopefully will expand the healthy lifespan, compress the window of morbidity at the end of life, drive costs out of the back end of life where all of the costs are stacked, and therethrough allow more people to access care. Grand vision, 4 years old. We thought hard about it. We built a spectacular business team around it, and we built a company to last. So we put a stake in the ground that's what we would do in the medical space. And we raised the bar on that. And so you're seeing a lot of the other players in the personal genomics space sort of coming into our paradigm with respect to how do you interpret all of the publicly available risk information? How do you communicate retrospectively derived risk information to prospective measures of risk accurately without doing 50-year prospective trials? How do you grapple with interactive models and really start to refine those risks? And recognizing that the information, the amount of information and the accuracy of information will continue to increase, costs of technologies will come down. We wanted to build the infrastructure for that. So that's what we've done. We're going to pour in information as it evolves. And again, you know, we built a slow ramp into the business model so that we could learn from all of that. And so we are exactly right on track. It's been interesting to see that consumers are not willing to pay for health care until they get sick. That's a fundamental realization that I've come to. People need that sentinel event in their lives before they modify their behavior largely. And so we're going to need compression of the entire ecosystem by, for example, Medicare, where they start incentivizing for preventive behavior and providing carrots and sticks with respect to coverage. We'll need private payers to do the same. Employers are already doing that. And that will come. That will come. But that's been the biggest challenge to date.
Just briefly, are you trying to engage directly with the consumer or work through existing medical and expand existing medical channels so that you go to your GP and the Navigenics test becomes just another test that can be ordered the same way as your LDL and PSA and other things?
Both. Again, fitting within the appropriate regulatory framework, we've made sure that consumers can access this information if they want it. We believe that scientists and physicians have been far too paternalistic with respect to risk factors to date. But we are seeing the largest expansion of the market in the physician channel, in the primary care physician channel.
Mm-hmm.